Hello and welcome to my channel, Fit&Fun PT. I'm Caitlin Pulsifer and I'm a physical therapist. I just wanted to give you an introduction to my new channel. It's going to be all about physical therapy and how I can help you, give you advice about physical therapy. So before we get into some more of the deeper content of this channel, I wanted to tell you a little bit about myself and how I got to where I am. So I am a new graduate. I went to Rocky Mountain University of Health Professions in Provo, Utah. Go RMU. I graduated actually this year in 2020, April, during all of the crazy stuff going on. But I'm happy to be graduated. I passed my NPTE and I am currently practicing it at an outpatient orthopedic physical therapy clinic. I am a member of the APTA, the American Physical Therapy Association. So as far as my personal goals, I have a lot out there. I'm a new graduate, as I mentioned before, but I am interested in orthopedics, in sports, vestibular health, and rehabilitation, and I would like to be able to work PRN in a hospital locally so that I can kind of do both settings and keep up my skills there. So my goal for the rest of this video is just to give you an introduction of physical therapy. What is it? What do we do? How it can help you? What you might expect in a normal visit? And kind of go from there. So in physical therapy, we treat a wide variety of patients in many different settings. The most common that you may think about would be the outpatient orthopedic setting. You may have a friend who had an injury or surgery. They went and got some physical therapy and got some treatment to help recover from that injury. That's what I'm doing right now. We also work in hospital settings. We go to people's homes. We work in nursing settings, like skilled nursing facilities and all of that. Okay, so I was just filming and my husband's helping me and I said, you name it, we treat it. It's not exactly true. If it's a musculoskeletal condition, meaning dealing with the bones or the muscles and things around it, then we treat it, but we can't treat every condition out there. But you would be surprised what we can do to help you feel better. Okay, so if you've never been to therapy before, I want to give you kind of a little rundown about what you might run into if you ever need to go in for anything. At least in an outpatient clinic, most of the time, day one, you go in, you get an evaluation done of what's going on, and that will be done by the physical therapist, and then they make a plan of care. So if it's something that we can help you with, then we want to treat you, help you feel better. If it's not something we can treat, then we'll refer you to a doctor, or if it's an emergency situation for some reason, we'll make sure that you stay safe, get that help that you need. The biggest thing that I want you to know is we're all about helping the patients. Like, we don't want to treat you if we can't help you, because it's just a waste of your time, it's a waste of our time. We don't want that. We want you to get better. So yeah, I mean, you'll come in, we chat with you, like to get a good history of what's going on and try and help you leave feeling better that first day. Now I want to go over some of the most frequently asked questions that we looked up online. Some of them on here. The first one is, what is a physical therapist? We already covered that one. But the next one that's associated is, what is a physical therapist assistant? Which is really important. So physical therapy assistants, they get an associate's degree and they're able to treat any patient at a regular visit. So they do not do the evaluations, but they are trained in therapeutic exercise, therapeutic activities. They know how to progress exercises, and they're trained also to know when a patient's condition is a little complicated and maybe they need a little advice from the physical therapist. And kind of piggybacking off of that, the education for a physical therapist has changed recently in the last 10 to 20 years. It's now a doctorate degree, so it's the DPT degree, Doctorate of Physical Therapy. And it used to be master's. Prior to that, it was a bachelor's degree. So it's, a 8 or 9 semester graduate degree. So it's a lot of work, a lot of effort to get there. So I think one of the misconceptions is people going into physical therapy and they don't realize how much work and how much knowledge we have to share with you. We're experts in this field to help you with rehabilitation. Okay, a couple other questions. How much will physical therapy cost? It's a great question. This kind of goes with another one. Will my physical therapy be covered by insurance? So a lot of that just depends on what type of insurance you have. Medicare, you get a lot of good coverage. Sometimes you have co-pays, sometimes you have co-insurance. A copay would be like you pay $35 every visit. Co-insurance would be, say you pay 20% of every visit. So depending on what we do in the visit, you may be charged more or less. At our clinic, we try to keep it based on a certain number of treatment units, so that way your cost is something that we can kind of project. We're not charging you more than you think. We do try to do that. Overall, what we want each patient to see is that the value of therapy is worth the cost that it is, because sometimes it can be expensive, but it's your life, it's your body, it's your health, and we want you to get better. If it's an issue or injury or pain that you're having difficulty with for a consistent amount of time, or if it's like a specific injury or post-surgical, those are kind of the three things that I would say. Or if it's balance and fall, that's kind of falls into a different subcategory. But you know, we all have aches and pains from time to time. Sometimes your knee will hurt for a few minutes. That's not anything to worry about. If it's consistent, oh, every time I stand up, oh, every time I sleep, my shoulder hurts all night long. Those are maybe some times where you could go see your doctor, you can come see the physical therapist. Direct access is a new up-and-coming thing, which means you don't always have to go in to see the doctor before you come see us. And we have that training, so if it's something that we're worried about, like, oh, this might not be related to something we can help you with, then we say, oh, well, maybe you should go in and see your doctor, get an appointment with them because of such and such issue that may be going on. So to end the video, I wanted to go out on a happy, light note. Like I said, my channel is Fit&Fun, so I wanted to show you a little joke, and I'll post this cartoon at the end. One of the funniest things that we deal with as therapists is people come in, show you this really funky thing that they do, and say, every time I do this, my shoulder hurts, and just don't do it. Just don't do that weird movement that hurts your shoulder or your knee or your ankle or whatever it is. Just don't do it. One of my professors had a similar story. His patient was swinging his arm around like as fast as he could. Said, my shoulder hurts when I do that. And his pain went away when he stopped doing that. So anyway, thanks for watching my channel. Please like and subscribe, and follow me on Facebook and on Instagram. I also have an email that you can email any questions to or comment on any of those platforms. I'd love to have some topics that you are interested in that I can cover and give you some advice and some information on. So let me know, and thanks for watching.